Hello, this is Dr. Gay from First Look MRI, and this is a 54-year-old male with complaints of headaches. And this is an MRI of the brain where we can see the right eye, left eye, the brain parenchyma is up high here. Down below is the tongue need oriented, and we see these two areas that are dark. This is the right maxillary sinus. Here's the cheek area, here's the left maxillary sinus. And in this patient, the brain was completely normal, but he did have some mucosal thickening in his sinuses. So this is the right maxillary sinus, and it communicates with the next sinus here. This is the right ethmoid sinus. And that one goes up and communicates with this right frontal sinus. And in this patient, they have a congenital anatomic variant where they just don't have a left frontal sinus. They just have a right small one. Sometimes there's no frontal sinus. It's a pretty common normal anatomic variant. But in this patient, there was a line of brightness around the periphery. This is a mild mucosal thickening or inflammation of that frontal sinus. The right ethmoid sinus is bright, so instead of being really dark jet black like air and bone, like it should, it's filled with whiteness. So this is mucosal thickening throughout the ethmoid sinus on the right. And if we come down here, the right maxillary sinus had a thin rim of brightness. And so this is mucosal thickening, and this mild mucosal thickening can cause headaches. So you can have sinus pressure headaches, and we're not sure if that's definitely what the problem is, but the remainder of the brain was normal, and this would be a plausible cause of the finding. So one other finding here, we can see he has a left maxillary sinus that looks normal. Air is black, so you have black air in there, and there's a little narrow channel. This is called the osteomeatal unit, and that air is a little air cavity, and it comes through and communicates with the ethmoid sinus here. This is an air cell in the ethmoid sinus that's dark, filled with air, and here's air, and you can see that little tiny channel, that little communication there. So this is the left osteomeatal unit, which is open, providing communication, equaling out the pressure between these two sinuses. Look on the right side now. We don't see that channel. It's occluded by this mucosal thickening. So there's mucosal thickening throughout the right sinuses and occlusion of the osteomeatal complex. In the end, that can cause sinus pressure headaches. And that's it. Thank you very much.